It's Karen feeling, and the atmosphere is pink. It's just going to get pinker right now because we have a team of Open Dreams with us. They're here to enlighten us on breast cancer, what causes it, the science, and the things we can do to prevent it, and most importantly, how to survive it. Welcome to Dr. Leticia Ababo. You're a medical doctor. Thank you for coming.
Thank you very much.
And right next to you, we have a midwife. She is also a volunteer at Open Dreams, Ninying Morin. You're welcome.
Thank you.
Okay, ladies, how's this morning for you?
The morning is great. Thank you very much.
Do you usually wake up this early, or this has been quite an effort?
I think as healthcare professionals, we're used to a very flexible time schedule. Yeah, so waking up early or sleeping late doesn't really affect us.
Okay, so our question of the day is, what is that one little thing that you do if you're having a bad day, but when you do that thing, you feel a little better? What's that thing? Share with other people who might want to learn.
Well, I love singing.
Oh, you love singing?
Yeah, and listening to music.
Okay.
So there's some music that really calm me down when I have a bad day.
Okay, that's a good tip. Yeah. So maybe by the end of this conversation, we'll ask the doctor to sing for us. How about that? We'll figure it out. What about you, Maureen?
With respect to the first question, like she said, we are health professionals, so it's not really something that is strange to us. We are used to. And then with respect to the second question, most times I go in for comedy.
Right?
Yes.
Cameroonian or international?
International, but Cameroonians like.
So which one is the favorite Cameroonian that really gets you going?
The Oracle.
The Oracle, right?
Yes, and there is also one from Boya, but I can't really place his name at the moment. Yes.
But the Oracle, Emmanuel, good morning. See, you're adding the brightness into people's days. Let's get into this really serious topic. It's interesting how when we talk about breast cancer, it's pink, it looks like it's happiness, but it's survival, it's hope. That's how I see this color. Tell us what breast cancer actually is and what it isn't, because there are times when we say things that are pretty wrong. Doctor.
All right. Thank you very much for the question. So breast cancer is not something that's very complex. It's something that's very simple, but we sometimes demystify it because we don't understand fully what it is. So now breast cancer is just the uncontrollable growth of cells in a particular tissue. So normally, when cells grow, they have a lifespan. They have a duration where they will live and they will program their death. That's what we call apoptosis in biology, a programmed cell death. But now, some cells or some tissues refuse to die. They grow uncontrollably, they get bigger, and when they get bigger, for growth, you need blood, you need oxygen, and you need nutrients. So they capture the vasculature from other neighboring structures, and when they grow bigger, they cause like a mass effect on the neighboring structures. So compressing the neighboring structures, and if they compress a nerve, it causes a lot of pain. So breast cancer is just this uncontrolled growth of these cells in a particular tissue. And in the tissues of the breast, we call them breast cancer. But in any other tissues, based on the location, we can name it based on the location. So that's simply what cancer is.
So what actually causes it? Is it inherited from a family member, or is it because of our lifestyle choices? What causes it?
So for the causes, there's no specific cause of breast cancer, because you can have a factor and you don't express the disease. So we call them risk factors. Risk factors are just events that will increase your chances of developing breast cancer. So since medicine is so broad and since there's so many things to put in place, we always classify it. So for the risk factors, we have factors that we can change, which we call modifiable risk factors, and factors that we cannot change, that we call non-modifiable risk factors. So for the non-modifiable risk factors, things that we cannot change, first of all, being a female. We're talking for breast cancer in particular. 1 in 8 females develop breast cancer during their lifetime, and 1 in 10,000 men develop breast cancer during their lifetime. So breast cancer is not only for females, it's both for females and men, but males. But the male to female ratio is too broad. That's why it's mostly specified for females. And also, advanced age is a risk factor that we cannot change for breast cancer, because when we grow older, anytime the cell divides, there are some mutations or some misinformation at the level of the genetic material. And this accumulation over time can lead to this expression of this disease. And also, when you are older, you are exposed to more hormones like estrogen and progesterone. You have a longer exposure to these hormones. And there are some cancers that are hormone sensitive. So prolonged exposure to these hormones can cause this. And we also have the genetic factors. We have some genes that cause this mutation. We call them the BRCA genes, which when you have it, there's a probability of you having this mutation, which can cause breast cancer. Now, for the modifiable risk factors, the things that we can change about ourselves, we have the diet. So it's advisable to eat less processed sugars, to eat high fiber and vegetable and fruit diets. And also exercise. It's advisable to practice regular physical exercises at least 3 times a week for at least 30 minutes. And also factors like smoking can help you prevent cancer, and also excessive alcohol consumption.
Okay, avoiding, if you don't smoke, it help you prevent cancer.
And also these are the risk factors. Those who smoke, they have higher chances of developing breast cancer. Those who consume excessive alcohol have higher chances of developing breast cancer. This is just as an effect of what these substances cause at the level of the cellular division. Yeah.
Wow, that is deep, but you were able to break it down in a way that we can understand better and make better decisions. Okay, before we get into maybe some signs, we're intrigued to know, because you are a midwife, how does breast cancer fit into your role as a midwife?
Okay, from the title, midwife, which shows I deal with pregnant women, I deal with even women of reproductive age. So my role as a midwife in respect to breast cancer, what we do is we educate women. We educate women on what breast cancer is, the risk factors, the signs, and how to prevent it. And also, we also go as far as helping them to examine them. Yes, when women come for their antenatal visits or when women come for preconceptional care, we help them to do these examinations.
So what are some of the signs you tell these women to watch out for?
Okay. We have a series of signs. I'll start by saying, I don't know.
And wherever you want to chip in, it's a conversation. Okay, yes.
Okay. So I will start with the first one, which is asymmetric. For example, if you notice that your breasts are not symmetric, like every human being, your breasts are supposed to be symmetric. But when you notice that your breasts are asymmetric, which means one is maybe bigger than the other, it shows that there's a problem somewhere. Remember, she said it's abnormal growth of cells.
Yes.
So when there's an abnormal growth of cells, it means that there's an accumulation somewhere. So obviously you have that lump.
Yes.
Yes. So when the first point, if you see your breast is not asymmetric, it's a call for concern. And then if you see a lump, it's a call for concern. Another thing is discharge, abnormal discharge.
Yeah.
Because it's not normal that a woman who is not breastfeeding is having fluid coming out of your breast. So when you notice this thing, it's a call for concern. Yes.
Okay. Well, it's a good time for us to wrap up our conversation on breast cancer awareness. Someone just joined us. He's Didier Younger, co-founder of Check Me. Good morning.
Good morning, ma'am.
Glad to have you here.
It's a pleasure to be here.
Please tell us, what is Check Me and how is it beneficial to the woman watching this morning?
So Check Me came up as a result of a co-founder losing a 45-year-old sister to cancer. And this was mainly because at the first diagnosis, it came out as a negative false. And it was later on, during the second diagnosis, they realized that she already had stage 4 cancer because of constant pain and the lumps that were constantly growing in her. So at the end of the day, they realized that she has breast cancer and she lost her life. It was too late for her to be rescued or to go through several, chemotherapy sessions, and there was no result at the end of the day. There was nothing that it could be done. So after losing this sister of ours, we lost our teacher again to breast cancer at stage 4, which often happens to about 70% of African women that are diagnosed of cancer, because they are always diagnosed at a later stage. So we thought it wise that why not think about something innovative to be able to assist not only the Cameroon women, but to carry every woman along. And
so
this is
how can you tell us about how it works swiftly? Because we have about 2 minutes to news time.
Okay. So Check Me is a digital platform that seamlessly connects patients to doctors and provides health information and is able to work with a 3D printed mammogram machine that reads and scans the breast area to be able to detect any abnormalities in the breast region, and through the platform good diagnoses are being made.
Yes. So how can we access this?
So CheckMe's platform is online, and you could always get to this platform. You could get to checkme.com, and you could always get to our social media handles. Through that, you could always get to the community, and we'll be able to assist you one way or another with the health issues.
Alrighty. In a bit, we're going to have the news in the English language, and immediately after, we'll continue our conversation because our focus is on breast cancer awareness, and Open Dreams is kind enough to share their knowledge with us. By the way, Maureen says she's going to teach us how to check our breasts, but that'll be after the news, so stay with us. So let's just wrap up with what you were saying, Didier. CheckMe, is it available?
Yes, it is.
Okay, so how can we access?
So you can access CheckMe through the platform. There's a website. You can check checkme.com, and you can always get to our social media handles, CheckMe Limited.
For those who are just joining us, a quick reminder of what CheckMe is again.
So CheckMe is a mobile platform that is built to seamlessly connect patients to doctors for healthcare checkups, free consultations, and to schedule appointments to be able to do breast cancer screening through our mobile device we are developing, a mammogram machine that is going to be able to detect issues or indicators of breast cancer.
All right, now I'll turn over to you, Maureen. This always makes me wonder, though. Do the hormonal changes that women go through give us maybe a possibility of getting breast cancer or not?
Okay, I will continue from what Dr. Leticia said.
Yeah.
Yes, it can, but now it depends on when.
Yeah.
For example, in pregnancy, it can predispose you to having it. Why? Because during pregnancy, there's this hormone, there are some hormones who are involved in rapid growth of cells, like we have the estrogens and progesterone. So when a woman is pregnant, those hormones are produced at a high level.
Yes.
Yes, so which can predispose the woman. But now, let's not misunderstand something here. If the cells were existing before, then when you get pregnant now, the hormone now helps to cause the rapid growth of the cells.
Yes.
Yes. And then sometimes you hear women ask, what about what about breastfeeding mothers? But I want to say that breastfeeding helps because during that period, the hormones are not produced. At this period, what we have is prolactin, which is strictly involved in breast production. Breast milk production. It has nothing to do with the growth of cells at the level of the breast.
Yes.
Yes.
So now, when we get to preventing breast cancer, it's all about screening.
Yes.
Are enough women doing the screening, or what do you think is stopping us?
I want to say that, let me say 50-50.
Okay.
Yes, because we have women who have been exposed to this and they are screening. Then we have those who have no ideas, or maybe they have heard and they are like, no, those are just superstition, or maybe, some spiritual people, they will say, no, that can never happen to me, God forbid, and they don't get to take measures. So I'd love to answer it that way. Yes.
Okay, let's talk about how we can do that breast check.
Okay.
Properly. Okay. So tell me, how do we do it?
So I would love to, let me demonstrate.
Please do.
Yes. Okay. Normally, I don't know if I can shift this a little bit.
We need your mic though, because we need to hear you.
Okay.
Yes.
Okay, so as a lady, normally when you bathe, before I go ahead to demonstrate, you have to do this once every month. And that should be after you've menstruated, a week after your menstruation.
A week after menstruation. Yes.
Or maybe before, if you know your menstrual cycle very well.
Yes.
Because if you don't know your menstrual cycle well and you're doing it before that, you might be tempted to think that maybe there's something wrong with you.
Oh.
So we prefer that you do it after your menstruation, a week after your menstruation, because at that level, everything is at the lower, especially estrogen and progesterone are at the lower level.
Okay.
You don't get to feel your breast being tender.
All right.
Yes.
So look at that woman and tell her what to do.
Okay, so what you do is, when you're about to examine, you stand in front of the mirror, you check yourself from your breast Because remember, one of the things you can detect is from asymmetric placement of your breast. So when you check your breast and realize that it's not asymmetric, what I mean by asymmetric, your breast not being at the same level. So you start by observation, you check, and my two breasts are at the same level. That's the first thing. Now, the next thing you have to do is palpate. And when you're palpating, you use your palms, not your fingers. Use your palm. So what do? You raise your hand. If I'm to palpate my right breast, I use the adjacent hand, which is the left.
Okay.
So the right hand, I place it behind my neck. The reason why I'm placing behind the neck is to make sure the breast is tension, so that if there's any lump, I'll be able to feel. But if I relax my hand, sorry for that. If I relax my hand, it will be difficult since my breast is it has tissues, and so it's mobile. So when I place my hand behind the neck, it makes it more tense, and then it will be easier. So what do? Either you can do it clockwise or anti-clockwise direction, or you can do it down, top, or left to right.
Yeah.
Yes. So what do you do? For example, let's say I want to use from left to right. Oh, is it? This is left.
Yes.
This is right.
Yes.
Okay. So, and you can also do this while lying on the bed.
Okay.
Yes, you can do while lying on the bed. So what do? I massage, and massage. Yes, the same thing. You massage. The same thing you do it. And then note, you have to also you have to go as far as under the armpit.
Really?
Yes.
Okay.
Because we have a metastatic, meaning that it has spread. So it's important to start at the level of your armpit here, then you massage.
Yes.
Yes. The same thing with the left hand.
So what are they looking for? What are we looking
The lumps.
for? So you
The
feel
breast cancer,
something.
Yes, to feel it, yes.
Like a lump when you are. Okay.
Yes. Yes. And then when you are done, you try to express and see if there's any fluid.
Okay.
Yes. You actually, like when you're breastfeeding, right? Yeah, you hold your breast to see if there's any fluid that is coming out. When you're doing, you do this one and you don't see it, it's okay. But now we still encourage that even when you do this, it's important to go for a check.
Sure.
Yes, it's important to go for a check. Always go to the hospital to check. Yes, because there are times that, well, let's say, I don't want to say that only those who know will be able to detect. There are times that you might think that you know, and maybe since the cell is still at a very tiny level, you might not feel it. So it's always important to go for a check.
Oh, that's beautifully done. I love that you're playing the hot and happening jingle, because something hot and happening will be happening here. Okay, so you're welcome back. As you can see, this t-shirt is offered by the Welisane Foundation. We can't say thank you enough. We have Open Dreams family here. We have the foundation girls as well. And it's going to be time to compete, to win some of these t-shirts. And it's simple. The game is the guessing game. We're going to have a word. It could be any word. It could be patience. One person will put it on their head, and the other person will have to tell that person what it is, without saying anything linked to that name. Okay? Patience. You can't say wait, because it's too easy. Use any other word. And immediately that person guesses, you have a point. Okay? Okay. So are you ready to try that game?
Yes.
Okay, that should be exciting. Now what's special about this one is it's only things related to Pink October, right? Okay. So who won? So these are the teams. You have two of you, and you have this extra lovely lady to add on to it. And then you have the Open Dreams team. Okay. So this is the first person here. Have a seat. And of course, we're going to start with Tracy.
With me, of course.
It's Tracy. The rest of you can step back a little bit so nobody whispers anything. Okay? We're going to start. I'll shift here because I kind of not trust you that much. Okay. So we'll have the first. You don't look at it.
Oh.
Hold it. But don't look at it.
All right.
You have to describe. You have to guess one word. You have 3 chances to guess.
Okay.
Start the description.
Strength. Bicep. Power.
Sorry, she guessed 3 times. What was the word?
Strong.
Strong.
No. Don't give it up for her. She tried. We'll have. Okay. Can you switch?
Okay. Yeah, sure.
So, no peeking and no trying to. Hold it up.
Oh my God. Okay, how will I say this?
First try.
Survive.
Oh my God.
No, not yet.
Okay.
Survival.
Yes.
Bravo. Next team. Pick any of your team members to go for the next. No.
Okay.
You. And one from the opposing team.
Okay, please.
She wants something for your team. Okay.
For our team.
Right. All right. Hold it. Try. Guess one.
Fight.
Switch. I hope you're taking note. This is already 2 points for that team. Who's suspecting this list? I'm looking at Tracy now, pink eyes. Why did I say that? Okay, hold it. Hold it up.
Okay.
Guess. Describe. First guess. First guess. Just guess something first.
Awareness.
Help her.
Relax. Pink.
I hope nobody's whispering. That's 2-1. Final team, come on. Final team, come on. Yeah. Okay. Was all for breast cancer awareness. Let's go. Hold it up. Hold it up. Don't look. No, shift. I don't need anybody whispering.
Please do it well.
Go.
I believe in you.
Guess one.
Do it again.
You must guess. Guess.
Breast.
The first one. Guess again.
Oh my God.
Guess.
Shaved.
You can say something. Anything. Say something. You can say a word. But don't say the direct word.
The month is about them.
Awareness.
Sorry. Woman. Oh my God. You need to switch.
She does not have
So I think we're still at 2-1, right? Okay.
Oh my God.
And this is the last one, okay? Okay. Why are you laughing? He may just know it. Go for it. We're already celebrating.
Breast.
Brad, give it up for yourself. So it's what, 2-2?
Yeah.
So everybody gets a t-shirt. Thanks to Wellington Foundation. Remember, breast cancer is a very serious thing, but at the same time, we use this opportunity to remind ourselves to take care of our breasts, male and female, okay? Together, let's say Pink October.
Pink
October. Happy weekend.